All right. Here we are. It's Facebook Live time with Dr. Brie and Kat from Direct Osteopathic.
Hello.
Hi. We're working with this on new technology since the computer wasn't working, so hopefully y'all can see us and hear us. But we are talking today about our Healthy Living program and why we decided to add weight loss medications as an RX path in that. And also just in general, why we started our Healthy Living program.
Yeah.
So Kat, take it away. You're the one who created the Healthy Living program.
Yeah, well, I saw a big need in our patient population as well as just, friends, family. It seems like weight loss is always a hot topic. And there are a lot of fad diets out there and dangerous things people are doing to their bodies. And I would like our patients to be, getting to their health goals, whether it's weight loss or lowering their blood pressure or their A1C or cholesterol in a healthy, sustainable way. Yeah. And so that's really what the Healthy Living program came out of.
Absolutely. And you and I have talked a lot before that when you came and joined the practice, I said, well, we have this Healthy Living or Healthy Hormones program. We have lots of perimenopausal and menopausal women in our practice, and I can do everything I can to get their hormones just right, but I cannot fix the weight gain problem and the metabolism change that happens at that time of life, especially coming out of COVID, seeing people in and out of unhealthy coping behaviors and unhealthy habits. Then all of a sudden, people have gained over the last, 4 years, sometimes 10, sometimes 20 pounds or more. And it's really hard to get it off because, we can get all these other pieces of their physiology correct and still not get the weight loss.
Right.
But despite all their efforts.
Right. And over and over you hear people saying, like, I'm doing the exact same thing I have done my whole adult life, and suddenly in the last 2 or 3 years, it's not working.
Yeah, so that's why we started Healthy Living, and you did a great job creating a program where you were helping with the accountability piece and health coaching and meeting with people regularly, because I remember even in residency, they were like, the evidence shows, doctor, that if you say at the wellness visit, hey, you should lose weight and exercise more and do things, like, it doesn't work. Right. It does not work at all for me to tell you, you should do more and try harder this next year.
Right.
The other piece I remember learning that was evidence-based is that, people can, make a lot of efforts on just maintaining their weight, and that's huge. Sometimes that's what we're looking for is not gaining, but to actually help people lose. I mean, there wasn't a ton of education around that because it was kind of like, calories in, calories out. That's kind of all you can do.
Right.
So the evidence shows that when you meet with people regularly on a weight focused visit or a healthy, living focused visit, you're going to have more success in achieving those goals.
Yeah. And I think for me, helping patients to kind of understand really what their goals are. Is it actually the 30 pounds to be back to the size you were in high school, or is it you want to be able to play with your kids on the ground? And those are two different goals. And so I like to not only focus on the weight, but focus on the why behind.
Yeah. Absolutely.
And I think that's helpful for patients to see that, it's not actually the 30 pounds, it's getting my numbers in my labs down lower or some other metric.
Right. Well, and oftentimes, if somebody's clothes don't fit, they feel like their parents or their grandparents or they're going to die of heart disease or, they have all these other concerns that go with that. And it's not just this one piece. So I have to say, I was initially nervous about adding the new weight loss medications, the blockbuster drugs, to our Healthy Living program because, one, you're doing such a great job with counseling and accountability and, helping people to identify their goals and meet them without the meds. But then we were seeing, the benefit of the medications, and I started to examine my own hesitancy around prescribing these GLP-1 medications, which we'll talk about what that means for weight loss. Because I thought back to residency when I was using these 14, 15 years ago, and I wasn't worried about them then because they came on the market at a time that the only option for those patients was insulin. So you had maxed out all the oral medications that you could do in a diabetic, and your next step was insulin, and insulin causes weight gain.
Right.
So it was just going against everything the person had been trying. Their diabetes would become better controlled, but their weight would go up and up, which of course caused our knee arthritis and other concerns. So when these medications first came on board and they had the side effect of weight loss, I thought that was really exciting, and I felt totally comfortable with these medications at that time. I mean, there were, every time you're in med school, they teach you not to be the first to use a medication or the last to use a medication. So I kind of was like looking out for the things then too, in terms of side effects. But a lot of people come to our practice looking to not be on medications. So how did you become comfortable with the medications that we're talking about?
Yeah, so I think, I was really skeptical. I'd say even maybe a little judgmental about these medications when I kept getting, seeing ads on social media about them. But the more I dove in, these medications actually have been around for a long time, which I think a lot of people forget. They've been used in, thousands of people for diabetes for a long time. So they're not new medications. We know their safety profile, and that they are targeting a naturally occurring hormone in the body is interesting to me. Like the science behind why maybe that hormone isn't as prevalent in some people than other people, and can we boost people up to get their weight down is pretty fascinating, like the biochemistry of it.
So let's talk about that. What is a GLP-1? What do people hear in terms of the terms that are around about that, and what does it do? What's the hormone?
Yeah, so the medications are GLP-1 agonists, which means it's going to promote more GLP-1. GLP-1 is a naturally occurring hormone in the body. It's mostly in the gut and some in the brain. And it does a couple of things. So the first thing it does is it will stimulate your body to produce more insulin. So that's where we see more steady state blood sugars. If you look at these people who monitoring their blood sugars while they're using them, it's like real steady.
Boring.
There are no spikes, no drops. It just stays steady. So that's one thing it does. The other things that it does is in the gut, it helps to slow down the digestion of food so that you feel fuller faster.
Interesting.
And then it also targets the brain a little bit and tells your brain you're full. You do not need more food. It also stops the chatter. And so a lot of people go through life always thinking about like what I'm going to eat, what's for dinner, if I eat this, it's going to be bad, all the like diet culture stuff. It just calms all that chatter down. And interestingly, there are lots of studies that people are doing right now looking at addiction because anecdotally people will say, and I've had patients say this, like, I actually don't crave alcohol anymore.
I've heard that too.
Yeah, and so that will be some interesting science to come out of it. So I started getting really very interested in the moment was all these other things that this medication could do, and really understanding how it works.
I think in medicine, we like medicines that have bang for our buck, right? Like if I'm going to use this medicine, like I try to tell people all the time, like I have a big toolbox and every tool I have has pros and cons, whether it's a nutraceutical, whether it's even a lifestyle intervention, whether it's a medication, everything has pros and cons. So I'm always trying to understand what are the pros, what are the cons. And so I think as these medications came out, we're talking about the GLP-1 agonist category is Saxenda, also known as semaglutide, also known as Ozempic, also known as Wegovy, right? And then we have the newer cousin Zepbound. Tirzepatide is the generic name there, and Mounjaro is another brand name.
Yep.
Did I catch all the names?
Yeah.
Every medicine has to have two names, just or more, just to keep us all on our toes. And this is no exception to that rule. But as those medications came out and they started targeting them specifically for weight loss for non-diabetics, I started to think, and then there was that article a couple of months ago, maybe like 6 months ago, about the benefit of these medications on inflammation. And when we think about, what drives the diseases of our time, in healthcare, Kat and I have had the experience of, we've been putting out fires for people all the time. I remember the first time I was in med school and somebody walked down the street and I was like, oh, that person's at risk for diabetes and because you start to see like risk factors. And over the past, I would say decade, we know that inflammation is a driver and insulin resistance is a driver of chronic disease, whether it's heart disease, we've known that for a long time, whether it's diabetes. And then now we're seeing that even those two factors play a role in Alzheimer's and cognitive health and brain health. So when the article came out about inflammation, that's when I really started to say, okay, Kat, how is it going prescribing these medications? Because people are already asking for them and we're already utilizing them. I think the other challenge that we're up against and still are out there in the whole world is the cost. of the medications.
Yep.
Yeah.
Yeah, and that's, I mean, that is something that gave me pause as well, was the cost. But, you know, we were able to vet a compounding pharmacy that we're able to get those medications for a lot lower cost for patients.
Yeah.
And a competitive cost with all of there are so many now companies that are providing these compounding formulas of the medication, but who knows where they're coming from. So
right.
I would prefer patients not be on these through other companies that, like, maybe you're just getting saline that you're injecting.
I know, and that's the thing, you just can't trust what you're getting. And that's what I say all the time about any of the nutraceuticals that we have. Like, if you get your fish oil from Costco, then, you know, it's not going to be effective, because we have to make sure that the Costco fish oil has, you know, 3,000 milligrams of EPA and DHA. And if you read carefully, on the front it says 1,000 milligrams of fish oil, but on the back, the active ingredients only have 2 and 200 of the two. So really in 2 capsules, you get barely 400 milligrams of the active ingredient. And so in the world of medications, that's been the concern about compounding, right?
Yes.
Is you don't know what you're getting. So that's where, I mean, we have a whole binder in the back over this compounding medication or compounding pharmacy that we have vetted. But we do try to get these medications through insurance if we can. It's just that the cost is outrageous, and hopefully that will come down.
Hopefully so. We can always try through insurance first, and I always put that out to patients. The other thing that I would say kind of sets us apart is that I'm not just going to prescribe it.
Yeah.
I'm going to actually have people sit with figuring out what your goals are. Yeah. You know, what does it look like for any nutrition changes, movement changes, stress reduction, all the lifestyle pieces that go along. It's not going to be an easy fix.
Right.
And that's the part I didn't like about the medication to start. And
Yes.
I that's what I do love about the program we developed is it's going to be, you know, something sustainable.
Right. And also, I mean, we had a pilot patient in today who used this medication, who's, you know, what you would consider normal weight, for inflammation alone, for chronic arthritis, based on, you know, an old car accident and multiple orthopedic surgeries. Home run. First time this person has had no pain in 7 to 8 years.
Amazing.
From arthritic pain.
Yeah.
Alone.
Yeah.
So we were talking about that, and this person said some really interesting things, because just like any fad diet, as soon as you're paying attention, you're paying attention.
Yep.
And this super healthy fit person said, I realized I was not eating enough protein. So tell me about the pitfall with protein and these medications.
I mean, the pitfall with protein is that you're not going to be hungry on these medications. And so I typically say, you know, we want you to be at least 100 grams of protein a day. And then when you start these medications, it is. And usually people are like, I eat a ton of protein. And then when we break it down, around 40 grams, I'd say.
It's
typical
normal.
Person, yeah.
Wow.
And so, but with these medications that make you feel so full and not hungry, getting to 100 is tough. But really important to get it kind of as high as you can, because weight loss is weight loss, and the body doesn't determine I'm losing fat or I'm losing muscle. And so when we see people on these medications for a long period of time, they may also be losing muscle mass, which is not what we want.
No, because you have frail elder people, and you have bone structure that doesn't have the muscle to support it.
Yes.
And so we added the bone density screening for this, right?
Yes. So
the DEXA scan.
Yes.
Tell me more about it.
Yeah, so I offer patients to get a DEXA scan for body composition.
As a baseline. Okay.
As a baseline, yes. For the folks who started on this medication before I figured out where to get that, they didn't have the baseline, but get it before, see how much of your body is made of bone, muscle, fat, and then also the visceral fat, which is the dangerous intra-abdominal fat around the organs. And then let's repeat it in 4 months and celebrate on the medication and see where we're at. And do we need to add in more muscle, weight-bearing exercise? Do we need to really hone in on the protein, because we don't want that muscle mass to go away? It's so important.
Right. Yeah, and that's where the strength training comes in, and not just exercising, but really doing some lifting and that kind of thing. So I think that's probably, in my mind right now, one of the bigger pitfalls, one of the bigger things to be looking out for. What other just side effects do you have people kind of be on alert for?
I mean, there's a lot of, the number one side effect are GI side effects. So
because it slows down the digestion.
Because it slows down the digestion. So constipation, nausea, vomiting, and for some people, diarrhea. What I do see is that the majority of patients who have these side effects say it's usually when we've increased the dose, and so for a couple of days after that injection they'll feel some of it, and then their body adjusts. So we do go slowly. The other thing that I am noticing is it's oftentimes associated with their eating. So I have a patient who was like, I had a piece of pizza and 2 beers and I had diarrhea for 17 hours. It's kind of that reminder. Yeah, some people have that anyway.
Regardless,
but also it's sometimes a nice like, hey, if I eat this way, which maybe isn't the healthiest way to eat, I might end up with these unwanted side effects. But some folks can't tolerate it, and that's okay. And I also, there are other tools in our toolbox if you're someone who tries these medications and can't tolerate it. A lot of these side effects are transient, and we can help with...
they go away eventually.
Yeah, absolutely.
Is that where the pancreatitis risk comes from? Is there a slight risk for that too?
Yes, so there's a slight risk for pancreatitis, which is inflammation of the pancreas and can cause vomiting and severe abdominal pain.
Yeah, that's not it's not indistinct. I mean, it's not like, ooh, I feel a little...
No, it's like I can't move. I need to go to the hospital.
Death warmed over.
Yeah, and that's just with the slowing. It's just the slowing down process of the food, and so diabetics are worried about that as well.
In the blood work. So if somebody is concerned about that, you can get a baseline or a follow up lipase.
Yeah, absolutely.
Yep, and then what about there's a thyroid cancer, rare thyroid cancer?
Yeah, so if anyone in your family has thyroid cancer, I would encourage you to figure out what type of cancer, because it's only a subset.
And not the most common type.
And not the most common.
The most common type of thyroid cancer is papillary thyroid cancer.
These are the medullary cancers. And so anytime a patient's like, oh yeah, I think someone in my family, and I just encourage you to ask and figure out what type it was.
Because that's a no-go.
It's a no-go.
Yeah, if somebody's had medullary thyroid cancer in their family, then you cannot be on these medications.
Then you cannot be on these medications.
Yep. Are there any other, just game-stopping no's?
Pregnancy. I wouldn't really want you on it if you're pregnant.
No. But if you were trying to get healthy before pregnancy and you were carrying extra weight, we do know that obesity and pregnancy are not a great combination.
You're higher risk.
Much higher risk. Yeah, so it might be something that you could do beforehand. So then let's talk about the magic question, which is getting off. And what does that look like, in terms of sustaining weight loss? Because I think that's the other common question that I hear is like, great, if it works, then what?
Then
because, our starting healthy living, prescription pathway is $450 a month, and that's a screaming deal.
Right.
And, these medications can be thousands of dollars a month for some people. So
Yeah, so again, it's not a quick start, quick stop kind of program at all. So my hope is that throughout our time, you have implemented healthy habits that just become normal habits. So that protein up, the muscle building,
strength training,
the stress reduction, movement, all those things are in place. And I always tell patients that coming off is going to look totally different for everybody. So for some folks, we'll wean everybody off the medication because you get to some level and you're done with the weight loss. You have to come back down. And so you wean off slowly. For some people, it may mean that they need an injection every other week for several months.
Usually it's once a week?
It's usually once a week.
Okay.
But when you're weaning off, you can space it out. You can do it once a month. We have some supplements that show promise for kind of sustaining that weight loss. And so that'll be a conversation about, okay, I'm now getting completely off of this. Then we'll add in these other supplements that help to boost that GLP-1 production in the body naturally, but don't always get people to their goals if we use just the supplement.
We are certainly trying those in the people who do not want to be 100%. On medications right away. If you want to just do our healthy living program, you can do supplement. The accountability, the kind of goal setting, and then just really helping people to stay on it, and then adding those supplements in. So those could be flanked on either side.
Yeah, and I read a study once that if you can sustain your weight loss for a year, you have a much higher success rate than maintaining that further. And so my goal in this program is let's get people to that year mark. And then and then let's see.
I wonder about that chatter. Like, if you can develop like a mindful approach to, eating and your health habits in that year, if that chatter, when it turns back on, you can be like, chatter, oh, hi, chatter, you're back, and if that can be a place that people can do a little work too.
Definitely.
Because they'll have had some time off of the chatter and the drive.
Yep.
I think that will show some really interesting results in the future.
Yeah.
As we know, the big drivers of chronic disease in our life right now are inflammation and insulin resistance, whether we're talking about heart health, diabetes, or even brain health and Alzheimer's, these medications have potential to benefit all of those pieces. So I think we'll have to see how the data pans out from here on out. I feel like every time I turn around, it's good for this or good for that.
Yeah. It's an exciting time to actually be prescribing them and just hearing about all the positive benefits.
Well, and it's nice to have a tool, because I think as a healthcare provider, it's always challenging to know that people are up against something, especially, some of my biggest patients are the ones trying the hardest, and they're doing all the things. They're going to the gym way more days than I'm going to the gym, and they're really watching every calorie, tracking everything, and still struggling. And it's nice to have a tool that can come in here and help. So I've been really impressed with the results that we've seen so far. Yeah. So if you are deciding that you are wanting to try these medications, know that we are just here talking about our clinical experience. We're not prescribing medications to anyone. This is not medical advice. This is just an opportunity to hear clinicians talk about the pros and cons of these medications. What I would not recommend is buying them from an unreputable source. I've heard them being sold at different bars, weight loss bars, IV bars, places where you can buy med spas, and that might be fine as long as there's a medical provider who's actually monitoring and you understand what your dose is. I think that the dosing is really complicated. Even Kat, who's been prescribing these in our healthy living program longer than me, has way better handle of the dosing. And I've been in medicine for 14 years and I've prescribed these medications for years. And when I hear people taking a dose that they don't know if it's a low, medium, or high dose, and then they get, there was a patient of ours that got sick with a stomach flu and then couldn't recover because of this slowing down of the gut. And then I was saying, well, what is your dose and when did you last take it? It has to be modified, right? And or it could be modified in those circumstances. Definitely. So you can get better faster and not keep vomiting. So again, you really want to have a provider that you trust. If you have somebody just, again, gives you one of these prescriptions and is like, see you later, bye, just like me saying, hey, you should lose weight between now and our next wellness visit, probably not as effective, right? Yeah. So find somebody that you can work with, that you trust, that can help you with the dosing, that can help you with the behavior changes and the sustainable, lifestyle factors that you need to be able to be successful, not only on the medications, but off in the future.
Absolutely.
Depending on how long they're indicated, I guess.
Absolutely.
Is there a limit to how long people can be on these?
No, I don't think so, because diabetics are on them for
years, decades. Yeah. Interesting. Well, I have to say, the last thing I'll say is the labs. I just see labs completely reverse. I see borderline diabetes or diabetes just completely change. I see high cholesterol, LDLs go down. Have you seen any other markers?
The CRP, so an anti-inflammatory marker, will go down as well.
Yeah. Super fascinating. Well, more on this in a decade. We'll know a lot more by then. Have a great day.
Bye.
Bye. I have no idea how to stop these things, but that's all right.